top 10 warning symptoms of a urinary tract infection that you should never ignore. Have you ever experienced a burning while you urinate? Or have you ever felt like you needed to run to the restroom? Gotta go right now. But when you get there to urinate, you really don't have to? Well, if so, you may have experienced a UTI or urinary tract infection. And if so, don't worry, you're not alone. UTIs are among the most common infections in the United States, and they are much more common in women than in men. In fact, 60% of women will experience a UTI at some point in her lifetime, but men can get them as well. And it's very important to understand how to recognize a UTI because they can lead potentially to serious complications. In order to understand what a urinary tract infection is, you first must know exactly what is the urinary tract. Well, it consists of your kidneys, which are those two bean-shaped organs located in your lower back and your flanks. It also consists of the ureters, which are the tubes that connect the kidneys to the bladder. Of course, the bladder is part of the urinary tract. That's what holds the urine. And actually, most UTIs are in the bladder, cystitis. And then also the urethra is a part of the urinary tract. And the urethra is a tube that leads from the bladder to the outside world. All of this makes up the urinary tract. Now, women do indeed get UTIs more frequently than men, and this is why. When you think about that urethra, that tube that connects the bladder to the outside world, for women, it travels a very short distance, right? But for men, the urethra has to go from the bladder all the way through the male organ to get to the outside world. And so when we think about bacteria, which cause UTIs most often, in order for them to get from the outside world into the bladder, for men, they have to climb all the way up through the urethra, the length of the male organ, before they get to the bladder. For women, however, there's not that much of a distance. So indeed, women do get UTIs more often than men. So by definition, a UTI occurs when there is an infection anywhere in that urinary tract that I just described. Most frequently, the UTI is caused by a bacterium, okay? Some bacteria like E. coli, Klebsiella that climb up through the urethra, and they most often land in the bladder. And so bladder infection is also called cystitis. But the infection can sometimes ascend. It can go higher, and it can be in those ureters, and it can even get into the kidneys. And when you have a UTI that's in the kidneys, it's called pyelonephritis, and that's actually an even more serious infection. You can also get fungal infections like yeast, especially in patients who are immunocompromised. So now let's talk about the causes and the risk factors for UTIs. Again, they are most commonly caused by bacteria. They can be caused by a fungus or by yeast. And the risk factors are very important to understand in order to know how to prevent UTIs. Sex. Yes, sexual intercourse is a risk factor for UTIs. And no, a UTI is not an STI or a sexually transmitted infection, but having sex does increase your risk for the infection. That's why for young ladies who get bladder infections, it's commonly called honeymoon cystitis. Another risk factor for UTIs is something going awry in the urinary tract infection as far as the anatomy. For example, if you have a kidney stone, this could cause a backup of urine or slowing up of the urine flow, and that could lead to a UTI. Please be sure to watch my video on the painful truth about kidney stones after you finish watching this video. Also, men, if you're a man with an enlarged prostate or BPH, this can cause a backup of the urine flow, which can lead to a UTI. And men, spoiler alert, any man who lives long enough, especially once you get past the age of 40, eventually you will get a big prostate. Question: have you ever experienced a urinary tract infection? If so, what were some of your first signs and symptoms to let you know that you might have something going on? Please share below. When you share your experiences, this helps others to feel less alone and it makes them more informed. Other risk factors for UTIs: if you are a patient with diabetes, you could be at a higher risk for having a UTI. Also, if you are immunocompromised, that's a risk factor for UTIs. So certainly patients on chemotherapy, your immune systems are being suppressed or pushed down, so you could be at risk. And patients who have had transplants, you take medications to suppress your immune system to protect the transplant, but this could put you at risk for UTIs. Do you know who else is at risk? Perimenopausal women, or women who are going through menopause. These hormonal changes can put you at risk. And pregnant women. Again, pregnant women have hormonal changes that can put them at risk for UTIs. Also, just the physicality of the baby in the uterus, the baby in the womb. Sometimes that baby can kind of sit right there on the bladder and prevent you from being able to fully empty your bladder. And this could lead to UTIs or urinary tract infections. Also, certain birth control can put you at risk for UTIs, specifically spermicides, like spermicides that might be on condoms. What they do is they can kill off some of the normal flora, some of the normal bacteria, and that can allow other bacteria to grow and cause a problem. Oh, and if you've ever been in a hospital and you needed to have a Foley catheter or a tube that's actually placed in your urethra so you can urinate without having to get out of the hospital bed, well, having these Foley catheters, these foreign bodies in your bladder, can put you at risk for UTIs as well. Bottom line, when it comes to the cause of a UTI, it is the bacterium or even a fungus that is climbing up the urethra and finding its way into the bladder, maybe going up to the ureter, and Lord forbid, possibly getting to the kidneys. And now for the top 10 warning symptoms you should really watch out for when it comes to urinary tract infections. Number 1, pain when you urinate. This is called dysuria, or a sense of burning when the urine flows out. Number 2, cloudy urine. Normal urine should be clear and a very, very, very light, faint yellow, okay, when you have a nice, well-hydrated urine. If that urine is looking cloudy, there's a great chance that you have bacteria in there, and this could be a UTI. Number 3, foul-smelling urine. You know how your urine smells normally. If you're getting a strong, pungent, or just bad odor in your urine, yeah, that could be a symptom of a UTI. Number 4, frequency. This is when you're getting up to urinate way more frequently than you normally do. Or if you're getting up at night or having nocturia, this could definitely be a sign. Also, in men, this could be a symptom of having a large prostate if you're getting up at night to use the restroom quite a bit. Either way, you want to get checked out and make sure it's not an infection. Number 5, urgency. This is when you are running to the restroom, gotta go right now, but you get there and you really don't have to urinate. Not much urine is coming out. This is called urgency. Number 6, pressure or cramping in the lower abdomen, specifically in the lower abdomen in the front where the bladder is. Yes, this can be quite an annoying symptom. A lot of my ladies will get this symptom and they're not sure if maybe their period is coming on or if it's, some type of something going on with the uterus. But quite frankly, the bladder sits right in front of the uterus. So sometimes these pains can be confused. But if you're getting a lower abdominal kind of a crampy pain or sometimes a sense of fullness, this could be a symptom of a UTI. Of these common UTI symptoms that I've listed thus far, which ones have you or a loved one experienced? Please comment down below. Now, for these next group of warning symptoms, these are a little more serious. And if you're having these, you may need to actually go to the doctor, okay, to get checked out because these could be indicative of a pyelonephritis or a UTI that has ascended, has gone up into the kidneys. And this could actually be very serious and even life-threatening. Number 7, fever. And by definition, a fever is when your temperature is 100.4 degrees Fahrenheit or 38 degrees Celsius. If you've been having some UTI symptoms and then now you're having a fever, this could be a warning that your body is having an overwhelming infection or sepsis, which, if left unchecked, could potentially lead to septic shock, a potentially fatal condition. Number 8, back pain. If you're having lower back pain or flank pain, this could definitely be a symptom of a UTI. And it could be indicative of pyelonephritis, that infection of the kidneys, which is often more serious. Number 9, vomiting. Yes, nausea and vomiting can be symptoms of a UTI. You may think of these as only GI or gastrointestinal symptoms, involving the esophagus or the stomach or the intestines. But no, a UTI, especially if that infection gets overwhelming or if you have a kidney infection, can cause you to have nausea and vomiting. Number 10, blood in your urine or hematuria. If you suspect that you have a UTI and you see blood in your urine, this could be a very serious sign and you definitely want to contact your physician or healthcare provider. Now, there are other things other than UTIs that can cause blood in the urine, such as kidney cancer, bladder cancer, or if you have an inflammation of the kidneys, like a glomerulonephritis, that can do it. Either way, having blood in your urine is not normal and you definitely want to seek medical help at this time.